We will turn now to a topic of discussion, something we have been discussing. Anybody that follows Dr. Ashton on her Instagram and on social media, you've seen this. She shared about hair loss, and in particular, COVID-related hair loss.
So we're kicking off a new series with some tools and some tips for our viewers called The Root of Hair Loss. And we brought in our friend, clinical instructor of dermatology at Weill Cornell Medical College, Dr. Michelle Henry, to answer some of your questions. So welcome. Thank you for being with us again, Dr. Henry.
Thanks for having me. We had to bring in the big guns, because I actually, when I shared this on Instagram, because I'm full transparency, I was blown away by how many people commented they had COVID, they're going through the same thing, some for other reasons. So first, just talk about what you're seeing in your practice in relation to COVID-19, because this is affecting a significant number of people, right?
Absolutely, and thank you for sharing it, because so many people are afraid to talk about hair loss. They're ashamed, they don't know what's going on, and it's happening. I'm seeing a lot of COVID-related hair loss, and COVID-related hair loss is due to something called telogen effluvium. So what happens with telogen effluvium is there's a major stressor to the body, and that could be something like COVID, or the flu, even grief. So losing a family member, major stress to the body. Pregnancy, aggressive diet, so a crash diet can cause it. And what happens is the growth phase of the hair, which is anagen phase, arrests. So we have 3 stages of the hair cycle. Anagen is the growth phase, there's catagen, which is a transition, and then telogen is the resting phase. So what happens, it arrests and shifts to the resting phase. And then about 3 months later, you start to lose the hair.
And so I was chatting with you backstage. I went to my dermatologist too, because I'm, as you guys know, being very aggressive with this. I have my little ponytail attached too. And he was explaining to me, in addition to TE or telogen effluvium, there's also something that affects the anagen phase with COVID, right?
Exactly. So COVID, we're seeing hair loss a little bit sooner than we see with classic TE. What we believe is happening is that COVID is causing such a robust inflammatory response, and the virus is actually injuring the follicles. So we're seeing hair loss as early as a few weeks, which is what we don't see with TE. So it's been really interesting to follow.
All right, so you mentioned your full transparency, and so you actually brought in a photo, an up-close photo of your scalp.
And you know, one thing that I think is really important, and I've said it before in relation to other things, doctors have doctors. So I am not a dermatologist. I don't treat myself. So I went to my dermatologist. He did a scalp microscopic photograph, and I sent it to you.
Yes.
Tell me what you could tell by looking at that.
Yes, so it was really under high magnification, so we could really see the follicles. And what I saw, actually what I didn't see is more important. I did not see redness. I did not see redness around the follicle, which is a sign of inflammation. I did not see scarring. We saw a little bit of a loss in density, but not super significant. And that's what we see with telogen effluvium. Right. So in some ways, it's a little bit unremarkable, right?
But we like that in medicine. We like that.
Exactly.
We like
unremarkable is what you want to be when it comes to a disease state. Because, you know, telogen effluvium is self-limiting. And so it's not going to cause, you know, long-term scarring, permanent hair loss. So we saw all of the good things on your photo, but that's what we expect.
That's good.
Is that something normal you can go ask for? I haven't seen one of those before, that magnification to get. Is that a part of a regular diagnosis?
You can. So a lot of doctors who see a lot of hair loss will have different technology to help them make that diagnosis, and that's one of the favorite ones, one of the top ones.
And so another thing that came up by looking at that is that he was able to tell, and you saw this also, that it wasn't patchy baldness that you would see more with TE. So while COVID for me, because I had COVID in January, may have played a little bit of a role, he then uncovered my diet, which you mentioned as another cause for TE, because I had a lot of breakage. I went vegan, as you guys know, about a year ago, and he said I wasn't getting enough protein. So it looks like, and then age, and then stress, and God, I mean, I have it all, right? But he uncovered a lot, and that's where I think a dermatologist can be really, really helpful in finding out the root cause, pardon the pun.
And we see that, you know, in most women, they have many reasons for hair loss. It's typically not just one thing, which is why we do a really deep analysis to figure out exactly what's going on.
And so talk about, I'm sorry, here about COVID-related hair loss. Is there something unique to a certain ethnic group, or can all folks be impacted the same when it comes to COVID, or other factors when it comes to your race could have an impact?
So everyone is susceptible to it. We do see that women and men who have a tendency towards having female pattern hair loss or male pattern hair loss may be slightly more prone to having telogen effluvium, but it really affects everyone.
So on my Instagram, for example, so many people are interested in what I'm doing. I'm sharing it all and I'm doing everything. But can you just take us through what you think are kind of like the big three things that people can do for thinning hair or hair loss?
Yes, absolutely. So one of the things we do with telogen effluvium, we try supplements. So a lot of my patients like that because it's something that's natural, it's accessible. What's great about supplements is that they create an environment that doesn't necessarily stimulate hair growth, but it creates an environment that's conducive to growth. So you're going to see things like vitamin D, you're going to see B12, iron, those minerals that we sometimes are missing, or vitamins that we're missing. We see biotin, which biotin can be a little bit controversial. You know, historically we use a lot of biotin in hair loss. The data actually shows that biotin's better for nails than for hair. And now we have some data showing that high levels of biotin can actually obscure some of your blood levels that are important to diagnosing a heart attack.
So more is not better.
More is not more.
But I was joking that I'll oftentimes just recommend people take a prenatal, even if they're a man, because it's just a good multivitamin. You would agree with that?
Absolutely.
Okay. So
absolutely.
Vitamins
are good in general. I've been taking them for over a decade. The prenatals, exactly. It has a lot of what you need.
Right. And what's this right here? This is the elephant in the room, or the helmet in the room. What is this?
Yes. So some of the treatments that we do. So this is a red light cap. So low-level laser therapy is something that we use with hair loss. It's anti-inflammatory. It may also increase the diameter, the thickness of the hair. It's easy. You use it 2 or 3 times a week. You look a little silly, but it does help. Yep. In isolation, it's not going to be a cure, but it works with many other treatments. So it's a great complement to everything else that we do.
Awesome.
They're so long, I just thought it was a centerpiece. Thank you.
We're going to turn it over and put flowers in it.
I completely forgot it was there. All right, Dr. Henry, it's always good to have you on, and it's certainly good to have you in studio. Thank you so much, Dr. Ashton. A lot of people want to say thank you for sharing your story.
I'll be sharing about my ponytail clip-ins soon, too.
And you all keep the questions coming to Dr. Ashton. You know her on her Instagram at Dr. J. Ashton. Again, thank you so much.
Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.